to the September 25th, 2024 Town of Littleton Board of Health meeting. In attendance are myself, Matt Wason, Dan Kane, Kevin Baker, Gino Fratelloni, Jim Gareffi, and hopefully Francis will be joining us shortly.
September 25th meeting.
Correct. Our first item on the agenda is our 7 p.m. public hearing on the Code of Conduct.
Yep.
Before we get further, Kevin Davis is unable to attend this evening, and he had the follow-up assignment to do a little more work on the Code of Conduct. So this is a public hearing, but I would say that we probably want to just push it out to another meeting for further discussion.
No problem.
And I'm thinking that perhaps the meeting on October 23rd, since we'll be dealing with some well water regulation at the next meeting, if that makes sense.
October what?
So moved.
October 23rd.
Mr. Chair, Francis has his hand up to be promoted.
Got it. So if anybody would like to make a motion.
I make a motion to postpone.
Motion to continue.
Motion to
I'll
continue.
second the motion to continue.
Okay, we have a motion, a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Gino Fratelloni,
Okay.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. We will therefore follow that up on October 23rd. Next item up is our 7:05 agenda item. It's a discussion on the arbovirus surveillance review. It is only 7:02, so we'll give a few minutes. Does anybody have any update or anything else that they would like to throw out to fill some time?
I can give a quick update on the retreat.
Perfect.
So the doodle poll went out. If everybody's able to get to that when you have a chance. I just threw out some times and some dates. It's for the last week in October, essentially. So if there's a strong feeling that another week will be better than that last week, I can change that around. So far, we've gotten 2 responses. And it looks like during the week, in the earlier hours, maybe 11 or maybe even earlier, perhaps in the morning, seems more desirable. It's just a question of how many hours you also want it to be as well. And probably in the next meeting, we should talk about an agenda list of what we want to tackle at that meeting as well.
How do people just feel initially about a 3-hour meeting? Is that a yay, sounds great, or no, we'll need some more time, or I can't believe it'll be that long?
We could break it up into 2 parts too as well, to do part A and then maybe meet for part B a little down the road once we start getting parts moving.
Kevin?
I was just going to say, we could block off 3 hours and then, see how far we get. And if we come to a comfortable stopping point, we say, we need to do some more homework, or we need to take a break and come back next week or in the next couple of weeks, put some more time on the books. It's up to whoever the board prefers.
Dan, were you going to say something? Go ahead.
I was going to base that same thing. I think 3 hours is a good starting point, and if we're good, we can always add more time. But 3 hours is plenty of working time. We could always end early if we need to. But no, I think 3 hours is probably plenty for a first pass at this. So,
11 o'clock start time. Was there any preference to start earlier or later? Or? Okay.
I had already responded to the poll, so I put all my choices in there. So I guess let everybody else do theirs. And
Yeah,
So
quick glance, it looks like October 21st is a popular day from 11 to 2.
Okay.
Or October 23rd from 11 to 2. So
Gino, would that work for you?
For me, yeah, I guess so.
So that'd be Monday, October 21st, from 11 to 2.
So
We
the
already
meeting
have
is
it.
not,
Sorry, go ahead, Gino.
the meeting doesn't not gonna start on October 23rd. They're gonna change it to October 21st.
We're saying to have a retreat outside of our regularly scheduled board meeting, which we do have one on the 23rd, the Wednesday, the 23rd. So we're saying, should we have our retreat, our Board of Health retreat on Monday, October 21st from 11 a.m. to 2 p.m.?
No problem.
Okay. That works for me as well. So we'll just jumpstart that. If you want to check in with Kevin Davis and hopefully he can make that time.
I'll reach out.
Let's pencil that in for now.
Okay.
It is now 7:06, so we will come back to our discussion on arbovirus surveillance review. Francis, what's the update?
We still have mosquitoes. If you look at the arborvirus report that we received on Monday, it looks like there's about 96 positive mosquito samples. We did receive some more West Nile virus cases as well, but in terms of EEE, I mean, nothing's changed. Like Frank from Central Mass Mosquito said, at this time of year, it's unlikely that a new generation will be born with the spraying. We knocked it down. So I don't think we're looking at an increased threat. I don't think we're going to possibly hit critical at this point. So it'd be up to the board whether we want to stick with the same DPH recommended response, which would be basically 15 minutes counting down each week until we hit a hard frost. If you look at the calendar in the packet, that will give you an idea of what times we're looking at. Parks and Rec have also been provided with this as well, and they're okay with it. School sports have been able to work with it as well. We have been able also, we had a really good response from staff from Parks and Rec as well as Conservation for getting signage out right away, laminated signage. So that was really good as well, just to note.
Questions from the board?
I guess I was just curious about the prevalence rate of, you know, like how many human cases are there?
So we have 4 human cases at this point in the season, which, I mean, in historically, so from 2020 to 2023, over the course of all those years, all combined total, there was 4 cases in Massachusetts. So looking at this data now, it's hard to gauge past years just because in 1 year we've already done what they did in 3 years previous. But again, because we were proactive about spraying, it is unlikely that we face any increased threat. And at this point in the season where it's getting colder at night, especially, the risk goes lower and lower potentially. So I don't think we're looking at an increased threat. I think it's good to use caution at this time of year because we're so close to the end, and it seems like it is working with the activities that we do after hours in town at this point. So it seems as a precautionary measure, it'd be good to stick with what DPH recommends. But it's certainly up to the board if we feel like that we want to not recommend or let the schools decide, or we can make a recommendation and the schools can choose to adopt that or not, of course.
I just went out to walk my dog and I got bit by a mosquito, so I got a little nervous. I wanted to make sure I'm
Oh, well, you're out. Yeah.
I'm in the clear. Thank you.
Matt, you're on mute.
Dan, you also had a question?
Not so much a question, but just I think a follow-up. I think we're close to the end. I think leaving our precautions in place is appropriate and reasonable. They've been accepted pretty easily by most of the stakeholders in town that I think it's probably appropriate to continue on with the track we've taken.
Yeah.
I agree. I think whether things are working or not, I think it's the right precautionary measures, as Francis mentioned, to kind of stick with the plan. I haven't heard any negative output from the guidelines on ending our activities early. Yes, that gets earlier and earlier as we approach October. But I feel like it would make sense to kind of stick with the plan, and we can readdress it in 2 weeks at our regular meeting. And if we've had a good frost and we think that the risk has dropped down, then I think we could revisit at that point. The only thing I wanted to point out is that while Littleton has remained at high risk for Triple E, I think within the last week, Concord also got added as a high risk. So the kind of high risk area has expanded to include Carlisle and Concord now. So I think at the state level, it still appears that the risk is around our community and our neighboring towns. So
Yes, Concord, they were raised because for 2 weeks in a row, they had high mosquito counts of Triple E in the area, even though they had no human cases.
And remember, just because they don't find any human cases doesn't mean that people aren't getting ill or having an asymptomatic illness. It can still be transmitting. Not that there's person-to-person transmission, which is great, but the mosquitoes are there. The mosquitoes are carrying the disease, so that means anybody could potentially still contract the disease.
Yeah. It's also important to consider, although we're focusing on Triple E because it's 30% mortality rate, West Nile virus is still prevalent, can still cause illness, especially in the most vulnerable. And there has been an escalation of cases on that in E2 as well, even though we don't particularly look at it as seriously. So, the advice is still prevalent for both.
Of note, Littleton is still considered low risk for West Nile, but again, not far. Stowe, Maynard, Sudbury are all in moderate risk level. Brad Lang has his hand up. I'll allow you in.
How you doing, Brad Lang, 76 New Estate Road?
Thank you.
Yep. I'm with the soccer board, and if you want, I can give you guys a little bit of feedback on how the youth sports have been doing,
Sure.
if that helps. So, realistically, the time changes every week, and drawing back 15 minutes isn't a super effect on us, because we got off the field tonight at 6:30, and by we're losing 20 minutes realistically, because now it's starting to get too dark for us to be out there anyway. The part that makes it a little more difficult is, especially with soccer, having all the game times for the varsity and the JV when they would play at night, because now they've had to play in the day, and that they're taking up the field space that we use to practice on, and we've had to really shuffle around. One thing, I don't know, and this is up to you guys, but maybe opening up for the high school teams to allow to play their night games. We haven't seen a lot of bugs out in the field, and I live right behind the high school, and I haven't had a lot of mosquitoes coming at me and swarms of mosquitoes since you guys have sprayed, which has been great. But maybe allowing those players, because you got some seniors out there that are going to lose those night games that they've played, look forward to all their lives. But as for youth sports, it's been okay with the time changes. I don't know if maybe opening up and allowing the high school to play at Alumni Stadium would be something. And plus, with it getting colder out, most people are in long sleeves anyways. So, just my thoughts.
What time are those games typically, Brad?
The JVs usually play at 5 for soccer, and the varsity would play at 7. And then the field hockey teams, they play at 6 p.m. And then the football teams play at 7 on Friday nights. So.
All right, thank you.
Yep.
Further thoughts or considerations from the board? The schedule of recommended end times is 6:30 p.m. for this week and actually 6:30 p.m. for next week as well. So I'm not sure why, but there's not a 15-minute break in there. That's probably because we're kind of ahead of the moon, as it were. So then it jumps to 6:15 the week of the 7th. I understand the impact on our youth sports. I personally would feel like an exemption just for a certain age group might not make a whole lot of sense because there are still a lot of age groups that might be attending. It's not just about the players on the field, but everybody else. And the other question I would say is the schools had a treatment that sustained on the plants nearby to reduce mosquito activity. Is that correct, Francis? It wasn't just a air spray to try to kill flying objects, right?
Yep, all fields in town.
Okay. And that was the week of what?
That was done 2 weeks ago.
Okay.
The week of the 9th.
And what's the estimated, do you know what the estimated length of time that's seen as effective before they would recommend a respray?
I don't. In talking with the director at Central Mass, he indicated that more spraying wouldn't necessarily have any effect at this late in the season because you're killing off the generation that has already been larviciding and is already grown and possibly already in the field. So he found it to be unlikely to help if we did further sprayings. I can follow up with him and we could follow up with youth sports to kind of discuss it further, I guess.
Perhaps the question would be if it was the barrier spray, at least for the residential properties when that's ordered by individuals, that's not a killing mechanism. That's a prevent the mosquitoes from landing nearby so that they can't live nearby and thus have a place to launch from to then try to stab animals and humans. So if there's still mosquitoes alive and around in the area, that could be an effective repeat. But I believe for the residential programs, it's usually on like a 5-week cycle, I think. So it might be too soon and might still be basically effective, but I don't know that.
I can follow up with Central Mass, see what they recommend, and maybe the board could go based on the recommendations of our consultants.
I mean, I would feel comfortable with that, knowing that we still have at least some activity that's in the evening time.
Brad, would you mind reaching out to me by either email or phone, and we can connect tomorrow?
It'd be a good idea.
Brad's back in the audience, so you can get in touch with him, right?
I'll figure it out.
Thank you.
You trying to get a hold of me?
Yeah.
There we are.
Brad, do you think you could either email or call me tomorrow and we could catch up?
Absolutely.
All right. Thank you.
Yep.
Anything further from the board?
Fine with me.
All right, so we're status quo, continuing to follow DPH recommendations, following our time calendar for activities. No other changes. Revisit in 2 weeks.
Okay. So I'll talk to Central Mass tomorrow. I'll provide an update to the board tomorrow afternoon.
Thank
and
you.
we'll talk to school sports as well. And 2 weeks.
Sounds good. Moving on, 710, the ID decision support tool is all about arbovirus initially, which we just discussed at length. I have not actually reviewed the data for our COVID numbers right now. Vaccinations are out and available. The CDC, if you have seen the ads, is actually recommending you get your flu shot and COVID vaccine at the same time. I can only assume they're recommending that in order to keep it down to one trip and make it more palatable for your schedule. I loved one ad that I saw that can't remember who it was. It was somebody famous that everybody would recognize, of course. Might have been a football player who had 2 Band-Aids on one arm. I might not recommend that because you'd probably never be able to use that arm again for the next 48 hours. But if you want some balance, a shot in each arm. But last season, there was some concern about getting both shots at the same time. But this season, as I said, the CDC has recommended that that is the way to go to save your time and save your schedule. So they are available. They're out there. And as Francis put out earlier this week, we also have test kits available. Correct, Francis?
Yep, they're flying off the shelves.
Flying off the shelves. I don't know if that's a good thing or a bad thing.
I ordered more, so that's how fast they're going.
So test kits are available. Come down to our Department of Health and get them from Francis or Brenda, whoever's there, and have those at least in stock so that if you get symptoms, you can do your own self-test to help you decide what steps to then take.
We've also finalized the upcoming clinic for October 22nd. It'll be held at the middle school again. Both COVID and flu shots will be available. There'll be a flyer out later this week, most likely, to pre-register for both.
Okay, that's Tuesday, October 22nd. Do we have a time?
3 p.m. to 6 p.m. Littleton Middle School, 55 Russell Street. Pre-registration flyer will be available through the news and announcements on the main town homepage, as well as on the board page as well.
The DPH recommended end time for outdoor activities is 5:45, so that's going to be all indoor, correct?
It will, yeah.
So no outside congregation late. Get inside and wait inside and then come outside and leave, please. Any other input on our infectious disease updates in the community? Nothing, Dan? You always have something good. Nada? Very well. That brings us to our administrative matters. We have 2 meeting minutes on the agenda for approval. I will start by saying I have not reviewed them, so I cannot vote on them. Have other people reviewed them? July 10th.
We can put them on the next meeting if you'd like.
The 22nd.
Kevin?
I reviewed them. I don't know if Gino and Dan have had a chance to review them.
Dan, have you reviewed July 10th?
I have not. I'm sorry. I did not get into OneDrive to look it up, and it wasn't in the packet. So that one's on me.
Not a problem. Let's push
We'll get
those
the-
up. Let's
We'll
push
get
those
the
up.
next packet out relatively early, so everybody will be able to review everything pretty comprehensively.
Thank you. That brings us to correspondence. Yes, Kevin.
I just wanted to say I did also review the July 24th meeting minutes, and there was a note on there that we continued a hearing or discussion about room count as it relates to Title V and septic system approval, and then we said we'd push it to our next meeting. And I know we never did talk about it again, so I just want to maybe make sure it gets on an agenda down the road.
So, yes, we had slated it for this meeting, actually.
Okay.
And I think we got a little bit derailed by the Triple E response that we had to jump on.
Okay.
So I believe you were absent the last time we discussed it.
Okay.
And I was going to email out after this meeting. So what we were kind of discussing was if everybody had thoughts about it and anybody who was willing to draft up an idea about it, because I think we're all coming from a lot of different directions. So the kind of takeaway homework was, if you have an idea of how you want this approached, draft a little something up and get it to Francis so that we can get it to the board members maybe in advance of the meeting.
Okay.
Same kind of thing as we were talking about for the well water regulations, which we should have on the agenda for the 9th. I kind of want to not do both of them at the same meeting just because I think it could take a long time. So let's pencil that back on for the 23rd of October for now, unless that agenda gets crazy full. Hopefully we just voted to continue it, not to continue to today because it is not on our agenda, or we could, I guess, make a motion to continue it even though it's not. I don't know. I'll turn to Dan, of course.
Why does everybody always look at me? I'm torn on if we addressed it for this one, but we didn't put it on our agenda. I don't know how that works.
We cannot.
I just wanted to make sure.
I would tend to say, we can't, but I think we put it on as we continued it and it wasn't on this agenda. Even though we picked this date, I think it's not unreasonable to say it just goes to the next agenda.
Sounds good.
If it's agreeable to the chair, I could put an email out specifically about that because that'll take some pretty heavy thought from a lot of members to send in stuff, and I'll need stuff ahead of time as well. So,
Yeah, yes, please go ahead and do that. Put the inquiry out there so that people have time to craft their thoughts and get a document together. It'd be great if they also get stuff back to you well in advance of the 23rd so that we could all be doing some review by email. Reviewing the email and then be able to have a better discussion about it during the meeting.
will do.
Thank you. Any other correspondence that warrants discussion?
No,
Dan.
Two things that kind of dovetail together a little bit. I submitted as a resident / board member, not just as a board member, some concerns about particulate matter air quality in the area of Air Road, Speck Pond, Whitetail, Spartan Arrow, around dust from the quarry. Certainly anybody who lives in this area is well aware the quarry is there. It was certainly aware when we moved in. However, for many years now, that for certainly many of us here on Whitetail and other neighborhoods, most of the year our houses, cars, lawns are covered in a fine white powder, inconsistent with dirt, but would be consistent with gravel, stone dust kind of stuff. So I put in a request for air quality assessment. I'm not sure the best way of doing that. Certainly there's lots of options for both particulate matter, size, and what it's made out of as kind of a first step. Is this just visual annoyance, or is there actually enough to be considered a health risk? And then 2 days later, we saw that we'd gotten a grant from Massachusetts, from the Healy administration, for 10 purple air station monitors. It looks like that's limited to 2.5 micron particulates, which are usually that size, usually the most dangerous for inhaled particulates, just because they're so small, they can pass through cell membranes and all the good stuff. So it kind of dovetails together, but even without that, looks like it's just a quantitative measure, but not a quality of what the substances are. So I'm not sure how to proceed with this, but I'm slightly torn that yes, I'm a resident and it affects me. So therefore, it's kind of a conflict of interest. On the other hand, it's not just my property. It's, it's basically a good section of town that's potentially impacted. So bringing it forward, I'm not sure what the best way to move forward with some air quality testing. Westford had a problem with their quarry over the last couple of years. They were investigated. The state DEP issued a fine. I forget the number, but not enormous, but big enough, but also required remediation consistent with standard OSHA dust remediation. Water and crusting controls on open piles and that kind of stuff. So standard dust mitigation measures that they may be doing at our quarry here in town. They may not. I simply don't know, but that's kind of part of the process I think that we probably should be looking at.
So, if it's helpful, I can provide a quick update on the first couple of steps we've taken so far. So in terms of receiving it, I mean, regardless of who it's from, it's still a public health concern from our standpoint. So it requires investigation regardless. So I wouldn't worry about any conflict in any way. Jim has been very helpful, and we're kind of putting our heads together on this one. So we've reached out to the aggregate owner. Taking some preliminary steps are going to be required. So we will be conducting a site visit to record what we see. We have reached out to DEP as well to kind of initiate what kind of steps need to be taken, in terms of early steps, and then what should we be looking to do in later steps, and how do we start that process that you described. So after a site visit, we'll most likely connect back up with DEP and probably get that steps going in motion. And I assume that's probably how Westford did it as well. So the process might look fairly similar.
Okay, great. Thank you.
Yeah, I want to echo that. Thank you. Citizen Dan Kane is well within his rights to report a health concern, and you're following the process exactly, reporting to our director, and he will now take care of it and apprise us of whatever might happen, because we all want to know, obviously. I assume it was unrelated to the 48-hour turnaround on a grant reward of some air quality monitors, or are those two connected?
I did that for Dan.
That was very impressive and effective work. I appreciate it. That was awesome. So what is our next? So since we're kind of talking about it, what is our next steps, or what are our next steps? So we have the grant for 10. Are there any guidances from the state as far as how we locate them, where we locate them? Is that kind of a collaborative between us and state? Is it just up to us? How does this work? What are our next steps to get these in-house, set them in place, and get them monitoring?
Yeah. So I was going to put it on a future agenda once we have some more specs on it. So our first step, I think, is to talk to IT, which I've already started the conversation, because they require a power component, and there's also a Wi-Fi component as well to be able to have real-time data. So that can present some challenges of where they can be placed. There are different avenues we can go, but essentially I've asked IT if we could kind of map out around town where the most convenient locations would be from a town perspective. DEP says you can also work with local residents as well, but that can be complicated in certain ways as well. So I think I'm mostly at this point waiting on what IT says where we can place them, see what kind of spread that would be, where they would be in town. So essentially, at an upcoming meeting, I provide somewhat of a map of where we have told would be good places to place them. And then using the board's knowledge, just being in town, we could kind of map out areas in general that we think would be appropriate. And between the two, I think we could come up with locations that way. We'd also put it out there with police and fire to hear what they would have to say as well. But however the board wants to move forward, I was thinking it would probably be best once we have everything in hand to put it on the future agenda, give you all the information ahead of time so you understood what they were. how they work and all that.
Great. Thank you very much for getting that kick started. Any additional correspondence? Then we'll leave it now to board member updates. Anything additional? Kevin Baker?
Nope.
Gino Fratellani?
No,
Dan Kane?
Nothing.
Jim? I haven't gotten to hear you say anything tonight. Anything else?
No, that's okay. Like I say, with Francis, just trying to get an inspection over to aggregate. So we'll take a look at what's happening over there and get back to the board.
Great, great. And Francis, anything else we didn't discuss yet?
The only other thing is in terms of mosquitoes, we also have a new webpage on the department page. For anybody looking for information about mosquitoes, we've certainly taken a lot of feedback since the Tripoli. So I have built a comprehensive page off our department where it describes almost as a Q&A type of function, everything you would want to know about what surveillance is in Massachusetts, what it is in Littleton, what methods we use, who to talk to, how
Would you mind-
to
Francis,
possibly.
would you mind just sharing it and showing it so that we have it on our video record too?
Sure. Let's see. Okay. Is that showing or no? Hmm. Oh, there we go. Okay. Everybody can see the page?
yeah,
All right. So if you go to the department page, it is the last link at the bottom here, mosquito surveillance reporting updates. In this page, this is what we're looking at. It's kind of a Q&A of the most relevant information. So we have press releases. Everything's a pull-down tab. Give the information on the most up-to-date mosquito information that we've set out as a board. We also have our real-time maps from the state, which might not show up in the screen sharing, or they will. Yes. So this is Tripoli. We also have in here as well West Nile virus down below. So if anybody wanted to see what the risk level was in our town, they'd be able to hover over it. And it would tell them what the risk levels would be. We'd also have numbers and where these numbers were captured as well for the season, as you can see here. And then we briefly talk about the basics of arborvirus surveillance.
can they spray?
Thank you for getting that built out there, Francis. I was just trying to figure out when we look at those maps from Mass DPH on the activity, I sure wish they could default to at least Middlesex County, but I don't think you can get, I know the filter's over there, but I don't think you can get that to Stick. That'd be interesting.
I I was impressed I was able to embed this. So,
Yeah, no, it's great that was there. I like that because that's the exact source that we use. But yeah, I sure wish their tools were allowed you to kind of pass that filter. The only other kind of thought and question I have is that menu list on the left side that's just a long blue bar. That's
Yes.
starting to kind of just, a lot of it's just swimming together for me. And especially for something like the mosquito surveillance, which is a hot topic, is there a way we could get that one moved up more towards the top, like the COVID vaccination sign-up form? I agree. Is there a chance that maybe that blue bar could split into kind of two categories? One, which is kind of current topics like COVID vaccines and mosquito information, and then a separate one, which is our more static, apply for a health permit, Board of Health, that kind of thing. Is there a way we could do that?
yeah, I completely understand what you're saying. That sounds like an IT solution. I will have to check into that.
Yes.
I'm sure there's a way.
We're getting more and more information out there, so I just want to make sure people kind of definitely can find the hot topic stuff nice and quickly. So, thank you for that update.
I
Anything
told
else?
Neil, so can I have something?
Nothing for me.
All right. I do not think I had any additional updates. So that's all we have for this evening. Mr. Baker,
Chair, I'd like to make a motion to adjourn.
motion to adjourn.
I'll second.
And a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Gino Fratelloni. You're muted. Gino, you're muted. We can't hear you. You're still muted.
Oh, you couldn't hear me. Okay, I'm
Now I can hear
sorry.
you. Your
I'm
vote.
sorry. It was a sort of a like, very short meeting. The question is, all because these bugs, they drive everybody crazy. Is anything that the state can go in different town and kill those bugs so we don't get sick?
I mean, it's something we can discuss, but I would say aerial spraying is probably not an approach we want to take at this point. And I think you hear a lot of feedback from the town residents if we went into aerial spraying. So we can certainly explore it, but perhaps later.
Right, because I'm very concerned about the children who go to school. You know what I mean? They're innocent. I mean, me, if I see a bug, right away, it's gone. You know what I mean? I bury them already. I mean, the kids don't know how to do that, so they gotta be protected.
Well, I mean, luckily we
There's-
were able to react right away. So spraying was done within a day or so of when we heard of the event. And we also had the board that was able to meet relatively quickly to provide guidance.
Apologies, Gino. We had our meeting, our urgent meeting. I cannot recall if you were there, where we discussed tripling the response. But
Okay.
right now, unfortunately, we have a motion and a second to adjourn, and we are in a roll call vote. So, Gino Fratelloni, your vote.
My vote is yes.
Dan Kane
And Kane votes yes to adjourn.
and Matt Wason votes yes. Thank you very much. Brief meeting.
I'm very
Back in
happy to
2
be able to
weeks.
see you guys.
Good night, everyone.